Good afternoon, everyone. We're going to let everybody filter in here to this forum. Welcome to the forum. We had a very large registration today. We're thrilled with. And yeah, let's get things moving here. So, hi, this is Rita Riker. I am Rita Riker, president of the board of Focus Greater Syracuse, and delighted to welcome you all here again. Today we'll hear about the findings and recommendations of the New York State Master Plan for Aging for achieving the goal of ensuring that older New Yorkers and New Yorkers with disabilities can live fulfilling lives in good health with freedom, dignity, and independence to age in place for as long as possible. Today's forum is sponsored by EDR, and we are very thankful for their sponsorship this year. So again, thank you, EDR. Today we have two experts in the plan who will take us through this today. First up will be Greg Olson. Greg is acting director of the New York State Office for Aging. He oversees the agency's day-to-day operations and the administration of federal and state-funded programs designed to assist the more than 4.6 million older adult residents in the state. Greg, take it away.
Well, thank you so much, and good afternoon. Happy Friday, everybody, as we move into the holidays. Very much appreciate the opportunity to be here today. This is a really, really important topic. I am going to provide a little bit of context because you can't talk about where you're going if you don't know where you've been. I do want to highlight, it's great to be on this panel with Nora. I've known her for years and years. And we wouldn't be talking about a master plan without the coalition that Nora built that pushed the governor really to issue a new executive order, which obviously we were a part of. But I give Nora a lot of credit for that. I see a couple people that are in the Zoom that I just want to highlight because this is like coming home. First, I want to shout out to Ingrid McCurdy if she's on. I see that Maria Brown from Syracuse University is on. For those of you that don't know, I am an SU grad. I got my master's in gerontology, social work. Diane Euler and Ken Genowick that work with Nora. I'm sure to keep an eye on her today. And I see Ray Babowitz, who a good friend of mine from the North Country, from the Federally Qualified Health Center. So I have a couple of slides. I'm going to start at 30,000 feet, but I do want to provide some context because New York is one of a handful of states that actually has gone through the process and issued a report on the master plan, and I'll walk through that. But we started this journey a long, long time ago. When I worked in the New York State legislature, there was no such thing as a master plan for aging. There was no such thing as age-friendly communities, and we had established this. I passed two bills in 2005 to look at what the barriers were in the community across sectors. And that's going to be really important because older adults don't just touch the New York State Office for the Aging. They touch every single system. I'll just give you a couple of examples. We have 32,000 veterans on our caseload throughout New York State in the community. 70% or 440,000 veterans are over the age of 60. We serve 29,000 older adults with a mental health issue, usually depression or anxiety. So we have to work very closely with the Office of Mental Health. We serve 9,200 people with alcohol or substance abuse issue. Don't even get me started on problem gambling. That's in a different agency. Adult Protective Services, which protects older adults from all kinds of abuse, is in Office of Children and Family Services. Benefits that we help older adults get, like HEAP and SNAP, they're in the Office of Temporary and Disability Assistance. Then there's tax and finance, there's housing, there's transportation, there's parks, and I could go on and on and on. And that's not something I knew until I got into government. I didn't know what the Department of State did, for example, and why the Department of State was such a critical partner with the health department in this, because the Department of State oversees and trains local planning and zoning. And I see a bunch of housing questions on here. We're going to talk about zoning because you can't build housing in New York State without municipalities actually agreeing to it. So this is not new to us. We became the first age-friendly state in 2018, and that was another cross-agency, public-private approach on how people of all ages, not just older adults, can live better lives independently with dignity in their homes and communities. And I've told Nora this before. When the idea of the master plan for aging first arrived, and her and I had talked, I'm going to be honest with you, I was a little lukewarm on it because I thought we have what we're doing in age friendly, but she convinced me very quickly, no, this is an opportunity. It's kind of like age friendly 2.0, right? It's an opportunity to correct some mistakes we made during our work with age friendly. It's something new that Governor Hochul can really attach on and kind of push out, and we could do better. So that's exactly what we did. So let me pull up my slides, but I wanted to provide that context because I think context is critically important. Right here. All right. Can you guys all see that? Nora, you're shaking your head, yes?
Yes, yes.
Okay. Okay, so what is the master plan? It's really recognizing the value of the older population. Now, anything you can do at the community level is going to benefit younger people, children, families, and older adults. But what we talk about at the state office, and I've been accumulating now for well over a decade, is we often start in the middle. I can tell you what we do. Nora can tell you what the foundation does. We can tell you how we do what we do, but we never talk about why. Why are we doing what we're doing? And if you've grown up in the United States, then none of this is going to be a shock to you. We live in an ageist society. We think of older adults as expensive, as frail, as takers, and non-contributors. And that is absolutely false. 80% of older adults consider themselves very healthy, active, and engaged, and we want to keep them that way. That's part of what this plan does. We recognize the economic, social, and intellectual contributions of older adults. So let me give you an example. 40% of all state and local taxes, $72 billion a year, are paid for older adults. We have 1 million volunteers providing 500 million hours of service, holding up 33,000 not-for-profits at an economic value of $13.2 billion. If you own your own home, you know that we're in a home rule state. Your local taxes go for Medicaid. They support schools. They support local businesses. Our spending supports 6 million jobs in New York. Social Security pumps $70 billion into the economy every year. Pensions contribute another $41 billion every year. This population is the number one givers to philanthropy, the number one givers to charity, the number one entrepreneur group. So in other words, we would not have a local, regional, state, or national economy without the older population, but it's something that very few people talk about. Well, I do because I know what the value is. And that's the why. We want to try to get in early to help people, if they ever need our help, stay as independent for as long as possible, stay healthy, stay active, combat isolation, reduce the risk of Alzheimer's disease, strength training to reduce falls, and I could go on and on and on. And then we can serve people who are literally nursing home eligible, keep them in their homes and communities for 5 to 7 years for under $10,000 a year. That's 1/17 the cost of nursing home placement. But let's just talk one more numbers. And you're probably saying, well, why is it geriatric social workers talking about the economy and numbers? Well, I love numbers first and foremost, but serving the older population and those that care for them is economic development. It just is. And so that's really what this is all about. How can we make lives better for not only older adults, but persons of all ages? So here's what we did during the MPA. It was almost a 2-year process. I think the executive order was signed about 2 years ago, earlier on in this month. And it was, it was like herding cats. My job with the health department and the Department of State was to facilitate a process. On the outside, you had Nora and her coalition that was help driving things from the outside while we were trying to organize things on the inside. But what you can see is the product that we produced over 18 months was not something that I was writing, was not something that I was editing, was not something that I was putting in or taking out. This was proposals that came from the people, by the people, to the state, based on your individual experiences, based on working with older people and families, and so on. So it was quite the collective effort. We have over 400 pages of recommendations, over 100 separate proposals. We did 20 public listening sessions in town halls. Over 430 stakeholders were engaged, had over 800 meetings. We created a council of state agencies for the reason I told you earlier. Older adults don't live at the state office for aging. They touch every single system. We had a stakeholder advisory committee, which Nora and many others were a part of. We were organized into 8 subcommittees with 34 work groups, did 10 industry roundtables, and then for my office, we did a statewide needs assessment survey that had over 27,000 responses. And we have one for every single county. So if you're interested in the Onondaga County area, or if you're from around Onondaga for others, those are all listed on my website, aging.ny.gov. And then there was an additional survey through the MPA that garnered another 10,000. So we had 37,000 people that responded back. And the questions were really oriented around what are the types of things that would make life better for you? They were livable community, age-friendly community, smart growth principles. So every single report is 162 pages long, but there is a mountain of information. And of course, what you're going to see in Onondaga versus what you see in Montgomery County or St. Lawrence County are going to be 2 completely different things. So if you're interested in planning, if you're interested in data or understanding the pulse of what's happening in your county, that's a great place to start. But again, it builds on things we've already been doing. We were designated the first age-friendly state in the country in 2018, and I was part of that process. We have what's called a health across all policies approach, meaning all of these agencies have a stake in what it is that we're trying to do to improve overall public health. It's not just my agency. It's not just the health department. It's all of the ones that I mentioned and more. We have a prevention agenda. Again, how do we make New York the healthiest that it possibly can be? We have an initiative called the Downtown Revitalization Initiative going on 8 years now, $100 million every year for the last 7 years, where downtowns can submit a grant for $10 million to the state of New York. And what did we do? We built smart growth, age-friendly, livable principles into those procurement, so that when they're designing their communities or looking to change the way they look, they do that in a way that's going to benefit me if I have kids, me as a middle-aged individual, and my parents as older people. We have age-friendly, more than 50% of our health systems and hospitals in New York State are designated as age-friendly health systems. And one of the things I forgot to put on there is we've been working with the courts, the Office of Court Administration, for a number of years to make the court system age-friendly. None of these things are individual. They're all collective to try to make life better for all of us living here. So I'm just going to give you a snapshot of the recommendations before I turn it over to Nora. Why are some in red and why are some in black? The things that are in red, we're already working on or have already done. The things that are in black, and this is, again, a snapshot. There's 100 of these, but let's talk about them. The number one recommendation was to invest money into my budget because we have people in the community that can stay in the community with a little bit of help and support. So we had the largest investment in NYSOFA history this year in the budget. It was $45 million, plus another $5.2 million in cost of living adjustment, and so on. So it's about $52 million in new money. That is out the door. That is in Onondaga County. That is in Schuyler County. That is all over the state of New York. One of the recommendations, incentivizing geriatric specialists. That is something that we really need. Now I'm going to talk about what's happening at the federal level. The budget that Health and Human Services proposed eliminates all the training programs in the country for getting people into healthcare, long-term care, and eliminated the only geriatric specialist training incentive program in the country. Food as medicine is something New York's been working on for a while. Create an Office of Older Workers. We did that with the Department of Labor 1 year ago, September. That was something that was already in the works. Workforce, combating ageism. Generally, and in the workforce, a priority of mine. It always has been. We've already done this. Create greater access to transportation. We're doing this. There's a lot more we can do, but we're doing this. Expanding initiatives to address social isolation and promoting social connectedness. Nobody is doing more than New York State, both direct to consumer, meaning in person, and technology than we are. I have over 30 public-private partnerships with tech companies. We're serving 2 million more people than we were 4 years ago, and many of those start with combating social isolation. Expanding awareness and training on elder abuse and financial scams. We're doing that. Strengthening access to hospice and palliative care. Department of Health just created a new bureau for hospice and palliative care. Why? Because we rank 50 out of 50 states in access to hospice and palliative care. Increasing vaccination rates. I spent an hour with the health commissioner this morning developing public service announcements. Half of our nursing home residents are not vaccinated for COVID or for the flu. The flu is exploding right now, and COVID cases are 3 times higher than flu cases. And so we have safe, effective vaccinations, but we're down from where we were last year in vaccination rates. Increasing housing supply. Governor has a $25 billion 5-year housing plan, but as I mentioned earlier, you can't build housing unless a municipality changes its zoning and wants that housing built in their community. Promoting lifelong learning. Can talk about that all day long through some of the things that we're doing. Developing campaign on scam and fraud prevention. Already did that. We're hopefully going to expand that. Combating ageism. I walked you through all the numbers a little earlier. There is nowhere I go, whether it be in New York or elsewhere. I just got back from DC. I was speaking in Vegas the week before, that I don't talk about the value of what older adults bring to their families and to their communities, economically, socially, and intellectually. Why? Because we don't see them that way. And, again, number 2, you treat things that you value differently than things that you don't value. So it's time for us as a society to recognize the contributions and value this population. And then increasing access to technology. We're already doing that as well. So I am going to stop there. That's the 30,000 foot view. I'm going to turn it over to my friend Nora, and then we're excited to launch into some of your questions because they were great, and I appreciate you submitting those in advance.
Great. Thank you so much, Greg. So Nora Surik is president of the Health Foundation of Western and Central New York and provides leadership in achieving the foundation's goals of addressing barriers to racial and economic health equity to achieve better health outcomes for all people. Nora also engages in statewide health initiatives, including as a member of the Stakeholder Advisory Committee for the New York State Master Plan for Aging. She's founder and co-convener of the New York State Master Plan for the Aging Coalition. Nora, you're on.
Thank you so much, Rita. And thank you, Greg, for the acknowledgement and recognition of our work and the long-term work that you and I have been doing together for many, many years. So hello, everybody. It's really a pleasure to be here with you all today and to be able to talk about one of my favorite subjects, which is the Master Plan for Aging. You know, Greg is right. We've been working on this for quite a while. Actually, Greg, it's been November 4th, 2022 is when Governor Hochul signed the executive order to create a commission for the Master Plan for Aging. And actually the coalition, which I'll talk about in a minute, started a year before then. So I've been at this for 4 years and counting. You know, Greg is really right in saying, you know, when I called him, you know, when I wanted to follow in the footsteps of California, because I knew in 2018 that California started their Master Plan for Aging. And I thought, wow, this would be a great opportunity for New York, and was waiting for our gubernatorial race, which is what California did, to start it. But then we had the wonderful opportunity, well, I guess depending on how you see it, you know, when Governor Hochul stepped up, and I thought, okay, here's a change in leadership, so let's reach out to her and to see if she'd be willing to do this. But first, you know, when I wanted to start thinking about this, and I reached out to Greg, and as he said, he was lukewarm. but we were able to talk through it. And one of the things that Greg was really concerned about, and I'm concerned about as well, is, we want a master plan, we want it to be active, we want it to be a live document and not to collect dust on the shelf. And that's where we are right now, to make sure that that doesn't happen. But let me walk you through until how we got there. So 4 years ago, I had a webinar with the people from California who started the Master Plan for Aging there. And we had over 300 people actually sign up for this webinar in November of 2021. And from there, we had over 100 organizations signed a letter to Governor Hochul asking for her to commission a Master Plan for Aging, which she finally did a year later. But we started the coalition that I co-convened with Bob Lancato, who is an expert in aging policy. He's down in DC, but he's from New York State. He knows every single person there is to know related to aging and policy. And so together, he and I have been convening the coalition every month for 4 years. And we now have well over 100 organizations that have signed on. We are now partnering with Age Strong New York, which is a campaign which is being led by Live On and AARP. Just to back up a little bit, Greg was talking about the whole process. The coalition has been involved in the whole process, and most of the members are the ones, what Greg said, there was over, 400 people who were involved in the 8 subcommittees and the 34 work groups. And most of them were led by people on the coalition and certainly staffed by it. So, and also convening the town hall meetings. So the members of the coalition have been very, very active, and we continue to be. We have a good relationship, obviously, with Greg and the State Office for Aging, but as well as with the Department of Health, and also with Smart Growth. Greg and I have been working with Smart Growth with the age-friendly communities and spreading that through New York State. So there's a wonderful long-term relationship there. So the coalition, now what we're doing is, because the master plan came out in June of 2025, this past summer, so we have it, as Greg said, it's a large number of pages. There's over 100 proposals in there. They are all grouped according to 8 subcommittees, and I won't go over them, but I'm going to provide my PowerPoint, which I'm not presenting right now. I'd rather just talk to you directly, but I'll be providing the PowerPoint presentation to put on the website for Focus Forum, where you can take a look at the 8 subcommittees, which is how all the proposals are organized. And you can take a look at that to see what you're most interested in and see what the proposals are, and take it from there. I also just want to tell you, before I launch into what we're doing right now, what the Master Plan for Aging is not. So it's a lot of things. There's a lot of proposals. There's a lot of work behind it. There's a lot of organizations that are involved in this. But what it is not a strategic plan, right? It's not strategic for aging services. It's a conglomeration of proposals by people who are interested and invested in seeing really services be supported and initiatives be supported that will serve older adults and people with disabilities. That's the other thing. It's not just for older people. It also includes a focus on people with disabilities and a focus on caregivers, both formal and especially informal caregivers. It is not only urban focused, we made sure that it included a suburban focus and especially rural focus as well. There are many issues that are not addressed in the Master Plan for Aging. It's just, with the number of people that have been involved, we got as many ideas in there as possible, but there are many, many more ideas that we can also start to focus on. And we're all open to that. The Office for Aging, the Department of Health, and Smart Growth are open to hearing what else, because we want this to be a living document. So when you take a look at that, and you'll see that it's planforaging.ny.gov. It'll have the whole volume there. Take a look at it and see what resonates with you, but also what's missing. And I just encourage you to advocate for that as well. The one thing also I just want to mention that is good, because Greg mentioned that it includes a lot of state departments, because as Greg said, aging, older adult services, people with disabilities, it's not just focused on a silo. One of the things about the master plan was to help break down the silos. So bringing all the state agencies that touch on people's lives to make it a healthy, thriving state and community for older people, caregivers, people with disabilities. So there is a council of all the state departments. And what was created is the New York State Bureau of Multi-Sector Planning. So in that, so the goal is to break down the silos. It coordinates all the interdepartmental work. And this includes the public health, transportation, housing, economic development, and community-based aging services, of course. So that is a coordinating factor within the state government, which we're really happy to see. But I do want to just stress that it's really up to us. It's up to you. The state can do what they can do, but they also need a lot of energy coming from all of us in the community. And this is what the coalition is now focusing on, is going to be working on developing an advocacy agenda and a legislative agenda. As I said, we're working with the Age Strong New York campaign led by AARP and Live On. I encourage you, if you're not part of the coalition already, feel free to reach out to me and I'll make sure that Focus Forum has my email. And we will invite you to join the coalition meetings because we need all hands on deck. Everybody who is involved in these services, who want to see a better society for older adults and for all people, we encourage you to join the coalition and to join in the advocacy platforms that are going to be developing and the legislative agendas as well. We do have some legislative action items that have already been identified. They'll be included in the PowerPoint presentation as well, which will be available to you. So when you look at the master plan for aging, I encourage you just identify what your priorities are, what the local priorities are for you. Also communicate with your own policy makers, because that's one way of really being able to make sure that your interests are being heard and elevate the voices of the older adults and the caregivers and the people that you serve because we are all in a position, we all have our own agency platforms where we can lend our voice. There's people, older adults, people with disabilities, caregivers who don't have the kind of platform that we have. And so it's our responsibility to raise their voices to the people at the state level and the legislators as well. Also, we're focusing on implementation because there's no plan for implementation. We've been really pushing for that, to have a plan for that, but there isn't. We also have been pushing for a progress report, or at least a dashboard, and we don't have that either. We're still working on that. So, and I'm working with a coalition of foundations also who will be putting in pooled money that we can use, the state can use, or the coalition can use in order to be able to create some of the things that will need money in order to be able to do that perhaps the state doesn't have. That's one of the things I just want to mention. When you look at the proposals, all of them are important, all of them are urgent. The state councils went through them all, so everything that's in the master plan has already been approved by the state council. But they did put a caveat in there. It all depends upon the state budget. And we know that the state budget is in dire needs right now. So we really need to coalesce around priorities right now and pushing for the state budget to be able to support a lot of these proposals or choose the ones that are most important. We're really focusing on, there's a proposal in there for $250 million to support aging services. And that's what the Age Strong New York campaign is being focused on. We really know that all across the state, aging services need an influx of money. It's been under funded for years. We also don't even have the Older Americans Act reauthorized yet, and that has been stagnant too for many years with their funding. So again, for implementation, so important to build coalitions, to leverage existing resources, and then to monitor progress. The coalition, the master plan for coalition that I co-convene, we're going to be developing a newsletter that we'll be sending out to the coalition to monitor progress. So where we see things already happening, and that's why I so appreciate, Greg, what you just put up there of what's already happening. I think it's so important to identify what's already happening, and then to monitor that progress. We need to understand early wins and where there is progress, because we don't want to lose momentum, and we certainly don't want to lose hope. We have a lot of hope that we can really be effective. So take a look at the master plan. What priorities resonate with you? What's already underway locally? And we want to know that, bring that to the coalition's attention, because then we can keep track of that. And also take a look at the plan and see, what do you want to focus on and where do you need support? Now, the Health Foundation does focus on supporting initiatives. We are located in 2 regions in Western New York. We focus on the 8 counties there. We have an office in Syracuse, and we focus on the 8 counties in Central New York. And we are supporting a lot of initiatives already, as Greg mentioned, age-friendly communities, age-friendly health systems, developing geriatric-friendly emergency departments. We have age-friendly Go Local, which is working with more smaller-based organizations to incorporate what they do, to include older adults in what they're doing, so that we can spread that out some more. And you can get more information on our website as to what we're doing. So that, let me stop there, because I know we've got a lot of questions, which I so appreciate. And I know Brian is anxious to be able to ask us questions, and we're looking forward to answering them. So thanks for your attention, and thanks, Brian. Take it away.
Thank you, Nora. So yes, Brian Hoke, our board emeritus for Focus, going to lead us through some of the great questions that came through. So Brian, it's all yours.
Thanks, Rita. Thanks, Nora, and thanks, Greg. Thanks, everybody who's here. I dare say this might be the most robust chat engagement we've had, which is yet another great thing, right? That people are fired up, interested in getting involved in and with this topic.
Well, when you got people like Nora on, I would expect nothing less.
Well, I mean, both of you, it's a privilege for us to be able to talk about this topic, doubly so because of the presence of you two. So we appreciate it. We had a lot of very wonky questions, which I say with love and respect, that is kind of how I roll. And I think many of our participants are folks who are here, attendees, about all sorts of aspects. Greg and Nora, as you know, having seen the questions, I'd like to start with a question, and you both touched on it in your opening remarks, about how this works at the local level. If we could drill down into that a little more. Cynthia asks about which ways does the New York State Office for the Aging support local OFAs, offices for aging, which I believe would be at the county level, but at any municipality, not-for-profits, if you could delve a little more deeply into how you connect with not just the state, but also with other levels of more local government, please.
Yeah, sure. And let me just start out when Nora was talking about the request for investments in aging. What that means is an investment in my office. That's what that means.
Got it.
So let me answer your question for that context. In what way do we interact with support the counties? In every single way you possibly can think of. So structurally, and again, you guys wouldn't know this, but a lot of the questions are going to wind up, whether it be workforce or other types of things. The federal funding that we receive under the Older Americans Act comes to my office. State investments in community-based aging services like nutrition. We run the largest nutrition program in the country, like our non-medical personal care program, like transportation, like home modifications, like benefits and entitlement assistance, like transportation. All that comes to here. And then what we do is we provide grants to the states based on primarily their proportion of the 60-plus population relative to the state. So as you can imagine, Brian, the largest counties, and no offense to, I know exactly where Nora's office is going to be New York City, up the Thruway, and out to Western New York. But 42 of our counties are designated rural. And they have a much more difficult time for a couple of reasons. Density of people, lack of providers because of that density. So the name of the game in a lot of these counties is the county office for the aging. And I think one of the most successful things that we've been able to do since 2019 is change how some of the funding goes out the door. So I've been collecting county wait lists since I got here in 2007. But what happened in 2019 is we established a new funding stream, and it's called unmet need. But really what it is waiting lists. And what that allows me to do is bypass the federal and state required funding formula and get resources directly to the county based on what their need is. Now, since 2019, there's been $200 million invested just for that. Let me give you an example. Franklin County, and Ray can chime in on this because he's there all the time. Franklin County is a really small county, rural. Malone is the county seat. If we had gotten our first 15 million, if that went out by formula, Franklin County would have gotten $37,500. You can't do a lot with $37,500. But what they reported to me in need was $490,000, and that's what they got. And this has really been the biggest growth area for us is the unmet need funding, because like I said, it directly targets where there's wait lists across the state.
Gotcha. And I imagine that difference of what, $350,000, $320,000 would not make as big a difference to Kings County or New York County, right? But to Franklin County makes a huge difference.
Well, I think the bottom line is what Nora had said. Look, I got to update my bio because we have more than 5 million people now over the age of 60. We have 4.1 million caregivers and 3.2 million people between 45 and 59. So half the state is under our purview in one way or another, right?
Gotcha.
The math on how we've organized our caring economy, we spend 97% of funds on long-term care and healthcare in the most expensive settings, and 3% for the types of things that we and our network does, and Nora and others. Now, if you look at the questions, well, I've looked at the questions. So for the audience out there, all your questions around community services. So if we have 110,000 nursing home beds, but over 5 million people over the age of 60, they don't need to go to a nursing home as the first line of defense, then we need to be making investments in the community. And that's what Nora was talking about in terms of asking for the 252 million. And where that came from was I developed an Older Americans Act modernization proposal during the pandemic, which the governor supported. Senator Gillibrand supported. Senator Gillibrand just introduced a bill to provide resources to states like ours to implement facets of the MPA.
Interesting. Nora, do you want to come in this question as regards relationship with counties and localities?
Absolutely. Thank you so much, Brian. And just to add to what Greg said, so locally, you can engage with the Aging Services Coalition of Greater Syracuse. That's being led by the Center for Healthy Aging at Interfaith Works, who is a member of the coalition. There was also the statewide Senior Action, and they have a local office, which is in Syracuse, located at the Philanthropy Center. And as I mentioned before, for statewide involvement, please join the Age Strong campaign, and you can join the coalition as well. And certainly, working with the offices for aging as well. We know that each of the county offices of aging have been asked to decrease their budgets. And I think it's so important to hear from those people within the counties to say that you don't want the budgets to be decreased. I think the more that people can raise their voices on keeping the budgets for older adult services steady, and if not increased, is so important. But we certainly cannot accept any decreases. So I think contact your local offices on aging, your county legislators, and let them know that you're just not going to stand for any decrease in budgets.
As you said before, Nora, we need your energy, right? Yeah. Go ahead. Sorry, Greg, to interrupt.
Exactly.
No, and I apologize to interrupt, but we keep talking about the county offices for the aging. One of my partners in crime is Becky Prevey. She was the Franklin County OFA director. She runs the Association on Aging in New York. So I'm going to give folks a little chance to write that down, and I'll find the link and put it in the chat. And she represents the 59 county offices for the aging, but we didn't go down a level. We contract with 1,242 community-based organizations. We work with organizations like Nora, like all the ones she mentioned, Live On, AARP. We work with public health departments, private organizations. So the community network is pretty broad. And I'm glad that Nora talked about county budgets, because for some of our funding streams, federal and state, you're required to have a county match in order to draw those dollars down.
Mhm.
And when counties start to cut their budgets, it means they're going to be drawing less money from us. And on the workforce front, especially in most of your upstate counties, the services are being provided by the county. So if the counties are cutting funding, cash funding, and they're also, letting people go or not backfilling their positions, you continue to shrink your capacity. Those dollars then shrink at the community-based organization level, which is going to have the same impact. So there's, it's like throwing a pebble in a pond, and the ripple effect. It's not just one thing. The caring economy, whether it be aging, health, or long-term care, is shrinking, which means more pressure is going to already be put on families who are already struggling. And I'll hit you with one other thing, and then I've had a lot of coffee today. So
Please. Yeah, this is great. Bring it.
HR 1, which you guys all know is the big, beautiful bill, blew a $750 million hole in our current year budget and a $7.6 billion hole in next year's budget. They are providing $50 billion over 10 years for rural hospitals, but Medicaid funds, doctors, nurses, PTs, OTs, medical transportation, hospice and palliative care. We're already seeing closures of wings of hospital or specialty services that are going away. So access is going to be much more difficult. Then you look at SNAP. SNAP was cut by $300 billion, passing more costs on to the states. So, I'm always the optimist, but it's going to get a lot more difficult for families regardless of age, just because of HR 1. And we don't have our federal appropriations bills yet. There was a continuing resolution that went through the end of January. And guess what happened prior to that? We had a 43-day government shutdown. We're going to be right back in this situation again at the end of January.
Gotcha. Well, let's move on to some of the other questions. Greg, you put up a list of sort of priorities of implementation going forward. I was interested that Jessica asked, which proposal not is the most important, but is the most feasible? And how do we work together to improve aging in New York State? That was a curious spin, and I'd be interested on your, is there low-hanging fruit that's both important, but, this one is easy. I presume none of them are terribly easy, but curious what you both think about that question.
Well, before I do that, I saw Amber Slichta just hopped on, so I'm going to shout her out, as well as Nancy Smith. So I see we got all of our friends that are in the chat. That's a difficult question. So if you're asking me personally, funding for our organization is the number one, because we know what we can do. I can give you a return on investment, right? I can tell you, the types of complex individuals that we serve, and we can do it, like I said, at 1/17 the cost. People want to stay in their homes. They want to be in the homes that they grew up in or they raised their families in. So, having the ability for our network not to put somebody on a wait list. Our average personal care client and our home delivered meal client, all right, hold on to your hats for a second, is an 83-year-old low-income female who lives alone, has 4 to 10 chronic conditions, limitations in activity, daily living, getting up, dressing, bathing, toileting, eating, and 6 IADL limitations, cleaning their house, paying their bills, preparing meals, shopping. That person right now is eligible for Medicaid. And we keep off Medicaid, plus we provide comprehensive case management. The clinical environment provides care coordination. Those are 2 completely different things. The other thing is, which is really low-hanging fruit, Brian, is scam and fraud prevention. Scammers are sophisticated, but stopping them is very, very easy. Scams cost older adults $27 billion. That's what we know, but only 1 in 44 cases is ever reported. So we're about ready to launch our 34th tech project with something called Silver Shield. which through email and text, we all get them, right? I didn't pay my throughway toll. Click the link. I didn't pay my mass toll. Click the link. You got this. Click the link. I get something from Sovereign Bank. I'm not banking at Sovereign Bank.
You can pay with a gift card. Go down to the store and get me some gift cards. It'll satisfy, right?
Absolutely.
Yeah.
We did a whole series of 5 to 7 minute scam prevention videos. Again, aging.ny.gov. You can look at the most common scams, but how to prevent. So that's an easy one where, collectively, like I can do public service announcements at no cost inside my agency, but I can't be the only one doing it. There are thousands of organizations out there, and it's just not just older people. My daughter had her Venmo account taken over, and all her money was taken out of it, and she's 20, right?
Yeah.
So, the things that I wanted to highlight in red was because there are things that we're doing. Then there's going to be things that are much more difficult that require money. Well, that's going to start to be a conversation in January when you go through the budget process. Then there's things in there that might need a statutory or regulatory change. That takes a little bit longer. There's things in there that are feasible. There's things in there that are absolutely not feasible. And it's up to us as leadership to work with the agencies, work with our coalition partners, work with all the stakeholders to figure out what it is we can do. This isn't a sprint. There's a sprint part, there's a jogging part, and then there's a marathon.
Gotcha. Nora, your thoughts on the same question, please.
So thanks, Brian, and thanks for that question. So there's actually, I have a list of 8 that says that of the master plan for aging proposals that have been identified as either near term or needing legislative changes. So just in answer to your question about so 1, strengthen home modification programs. That's proposal number 19. Expand the Empire State Supportive Housing Initiatives. That's proposal number 103. So these all require legislative action, but are seemingly doable. And then Greg mentioned Medicaid. So proposal number 125 is the continuity of medical treatment and medications access in short and long-term care facilities. So that's important too. But I also just want to mention something because Greg mentioned Medicaid. So any of the people who are in this webinar, if you are working with a community-based organization, please consider partnering with the social care network. So this is part of the 1115 Medicaid waiver program here and I know Inclusive Alliance has been working with Healthcare Association, I think it is in Albany, and Inclusive Alliance is also one of our coalition members. But I know in Western New York, the Western New York Integrated Care Collaborative is a social care network. They receive $38 million in Medicaid dollars, and they're partnering with community-based organizations to provide transportation, housing, and food security. And all those community-based organizations that are providing these services that address the social determinants of health are going to start receiving Medicaid dollars in partnership with them. So anybody who is part of a community-based organization, please, I know some organizations have been reluctant, but I'm encouraging you. The Health Foundation did do a webinar on this, and you can access that on our website, I believe. If not, I can send that link out to everybody. But there's Medicaid dollars on the table to address transportation, housing, and food insecurity. And I just really hope that community-based organizations will partner with their social care network to meet these needs in the community and to get more revenue from Medicaid for their own operations.
Thank you. So the only downside of this session is that we don't have time for all these wonderful questions. Yeah. We have time for just one more, and I'll sort of agglomerate a whole bunch of them we had about housing, right? You both touched on this in your remarks, but I wonder if you might just say a few more words about those aspects of the plan and moving forward with implementation and goals as regards housing for older folks.
Yeah, I mean, I think the goals are fairly straightforward. Governor wants 880,000 new units, has a $25 billion 5-year housing plan. As I mentioned, we're a home rule state, which means the state can't just come into town of Bethlehem, where I live, and just start building housing. So in order to try to incentivize the changing of the zoning laws locally, and that's again why the Department of State is so important. And I did want to just shout out Liz from the Office of New Americans, who reminded us all that ONA is part of Department of State. I mean, they do a ton of stuff. She's provided $50 million the last 2 years for incentive grants to municipalities to do exactly that. So that's great. But there's other things in there. Like, I don't know about you guys. I drive all around the state and all around the country. And what I find continuously fascinating is they're still building $700,000 single family homes. So there is a lot within the MPA to talk about other options. My administrative assistant just retired and built a micro home in Greene County. You could put these things up in a day. They cost $25,000 depending on who you go to. They're incredibly energy efficient. They go up very quickly. They're extraordinarily nice. I've been in them. There is ability for, again, to change zoning to put a unit on if you want your mom or if you have a younger disabled son or daughter to move in. But all of that requires local zoning changes. And everybody knows we need the housing, but it's the old not in my backyard. And so until this is simple supply and demand. If you don't have a lot of housing and you have a lot of people, the costs are going to go up. I was with the Senate Majority Leader in Westchester a couple of months ago, and I asked her what the cost of a starter house is. So somebody like my daughter now, 21 years old, getting out of college, she's a teacher. What's the cost of a starter home in Westchester? It's $829,000. Nassau County, $749,000. So you wonder why kids are living with their parents until they're 40, or living in group settings. I mean, that is just crazy, but you can't do anything until you increase the supply, and the supply happens at the municipal level.
Gotcha. Thank you. Nora, we only have a few minutes, but the last words are yours, please.
Oh, last words. Well, I just want to add to what Greg is saying. So, and really directing people to look at the master plan for aging, because there's 9 strategic pillars, and one of them, number 4, is housing access and community development. So take a look at that. And then of the 8 subcommittees, number 8 is housing, community development, and transportation. So I just ask people to take a look at the master plan, look at those proposals, see what's in there, see what resonates with you and what you want to start supporting and implementing and advocating for. Housing is essential. We need more housing. And I know I'm really concerned about older, especially in Syracuse. I'm really concerned about housing because I hear a lot of older adults are being pushed out of their homes in order to accommodate students, but also, and I always get Micron, right, coming in. And so they're looking for housing to accommodate more people coming to work for them. And so there's during COVID, the consortium of foundations came together to help support eviction prevention and to provide legal services. So I just encourage people, if you know anybody who's at risk for being evicted, please look up legal services because they can help with eviction prevention.
Gotcha. Well, Greg, Nora, thanks for being here today, and thanks for the work you do. I'll turn it back to Rita.
Yes,
Hey, we
and
should
I
do
will-
this. We should do this again sometime.
We have ample questions. We
sounds
could
good.
fill another couple hours.
Yes, I want to add my thanks to both you, both Nora and Greg, for this very informative session. And of course, Brian, for all the Q&A. We appreciate your moderating that. As with all of our forums, this has been recorded and it will be posted on the Focus website, focussyracuse.org. We'll also, if Nora and Greg, I think you're going to be sharing your PowerPoints, we'll also have those available on the site so people can come there to view them. We're very grateful to all who have helped us keep Focus going with your donations and sponsorships, particularly for this session. We're very grateful to EDR for their sponsorship of the session. If you are so inclined, there's a very easy way to give a donation to Focus on our website, and donation of any amount is greatly appreciated. Beyond that, thanks again. And everybody, I'm wishing you happy holidays, and we'll look forward to doing something again, maybe in the new year. Thank you.
Thanks, everybody. Happy holidays. Be safe.
Stay safe, stay sane, stay healthy.